Hi friends, I am Dr. Datta Ram. I'm a consultant surgical gastroenterologist and a laparoscopic surgeon practicing in Hyderabad. Today I am talking about hiatus hernia. Hiatus hernia means protrusion of the stomach and the gastroesophageal junction into the chest. Normally the food pipe is in the chest, whereas the junction of the food pipe and the stomach are in the abdomen. So when this junction of the food pipe and the stomach, that's called a GE junction, and the stomach protrude into the chest through an opening in the diaphragm called as hiatus, is called as the hiatus hernia. What are the symptoms of patients who are having hiatus hernia, or what are the types of hiatus hernia? Does everybody with an hiatus hernia need surgery? Hiatus hernia is a common finding in many endoscopies what we do. So many patients may be asymptomatic, maybe an incidental finding on endoscopy. But hiatus hernia is known to cause certain symptoms, especially the acid reflux or reflux of acid from the stomach into the food pipe. So this is called as gastroesophageal reflux. So normally there is a tendency of the acid in the stomach to move into the chest, because in the chest there is negative pressure and there is a positive pressure in the abdomen. So due to this pressure difference, there is always a tendency of acid to go into the food pipe. There are many anti-reflux mechanisms, especially the GE junction being in the abdomen, the tight hiatus, the lower esophageal sphincter, the angle of his, etc. The peristaltic function of the esophagus, which clears the contents inside the esophagus like this. So it prevents acid reflux. So patients who have hiatus hernia have a increased chance of having or developing acid reflux into the chest, and also symptoms due to this. So symptoms are like chest burn. They have burning pain in the chest and regurgitation of food. So the food comes into the mouth. So whenever there is reflux, the patient will experience a burning kind in the mid lower chest, or sometimes higher up, so much so that they also have pain in the throat. So this will exacerbate or increase when they bend forward. The very classic of acid reflux problem. And some patients, especially those who have a hiatus hernia, there is reflux of stomach contents into the chest. Along with there is a food. The food starts coming into the mouth. That is called as regurgitation. So this is not vomiting, but it's a passive reflux of food into the mouth. So as a result, patient will have experienced bitter taste in the mouth, and they have to clear the throat, drink water often. So in some extreme cases, patients also develop something called as extra esophageal symptoms. That is, they aspirate or the stomach contents into the airway. That is the vocal cord and the lungs. So whenever this happens, some patients experience change in the voice due to chronic reflux. They have to clear the throat often, and they also develop cough. So unexplained cough in some patients due to acid reflux also is a very known thing. So especially in the night when the patient goes to bed, they experience this acid reflux and get up in the night and start coughing. In some extreme cases, we have seen patients developing pneumonia, that is infection in the lungs, and due to acid reflux. So all these things can happen due to a acid reflux. So other complications of hiatus hernia are nothing but complications of acid reflux, that is ulcerations in the esophagus, the bleeding from the ulcers, and in some cases when the depth of ulcerations is very deep, and these ulcers are very deep, patients can develop stricture or narrowing of the esophagus. So when there is narrowing or stricture of the esophagus, there is a difficulty, patients experience difficulty in swallowing because there is blockade to the flow of food. So they have developed vomiting, they take long time to eat. There are two types of hiatus hernias. One is sliding hiatus hernia, means that is called as type 1 hiatus hernia, wherein the GE junction, that is the junction between the food pipe, that is the esophagus and the stomach, just slides into the chest. And the second thing is called as a rolling hiatus hernia. Rolling hiatus hernia is the junction is in the abdomen, whereas the stomach rolls by the side of the esophagus into the chest. This is a more dangerous form of hiatus hernia. Sometimes it is combined, both sliding and rolling kind of hiatus hernia. So if it is just a sliding hiatus hernia and patient doesn't have any symptoms, this can be left alone like that without any treatment. And if the patient has acid reflux symptoms, then they will require a surgery called as Nissen's fundoplication, which is performed laparoscopic way. If there is a rolling hiatus hernia or a combined rolling and sliding hiatus hernia, then surgery is the best option. So because these kind of type 2 and type 3 hiatus hernias are prone for complications. Suddenly if it increases, if the herniation increases, the stomach can go for acute obstruction and gangrene. So always a rolling hiatus hernia needs a surgical treatment. Thank you so much.